Welcome to Conscious Insights, Strategies for Leadership Evolution. Engage in roundtable discussions that spark deep dialogue with executives and thought leaders to advance conscious leadership and explore innovative practices. Join us and gain insights that will elevate your leadership journey. Hi there, and welcome to Conscious Insights. Today, we are going to discuss a topic that is near and dear to my heart, purpose-driven leadership, the heart of success. And we're going to talk a lot about exploring the essence of leading with vision and values. And so I'm very excited for my guest today, Ross Brooks, who I've known for many years. He's currently serving as the president and chief executive officer of the Colorado Community Health Network. And prior to his coming to CCHN, is what we call it, Ross served as a CEO for Mountain Family Health Centers, which is a community health center in Western Colorado. And I'll post more about his bio, but I think another thing to know about Ross as we start talking here is that he's driven by the belief that access to health is a human right. And so with that, we'll talk about how the purpose and the heart of that comes to life every day. So Ross, welcome to Conscious Insights.
Thanks, Renelle. Lovely to be with you.
Yeah. Is there anything I missed that would be really important for people to know about you?
Oh, I'm a dad. I've got 2 kiddos, been married for like almost 20 years now, and live in Western Colorado in the beautiful mountains.
Awesome. A beautiful, beautiful place. And you're commuting back and forth to what we call in Colorado, the Front Range, and to Denver now. So thanks for joining us in the Front Range as well.
Yeah, my pleasure. Lots of snow out today, which is good for the mountains and our ski resorts.
Yeah, we're recording this in November, so it's early snow for us. So Ross, let's talk about purpose. When I wanted to talk about purpose and heart-based leadership, you were one of the first people that came to my mind because I have worked with you for many years. And also I have watched you balance the head and the heart. I've watched you bring in the importance of what it means to be a purpose-based leader. So when I say that, what does that even mean to you to lead with purpose?
Well, it's such an interesting day to be talking today because it's the morning after, or just barely the afternoon after our national election. And that's a time where I think this messy process of democracy has many people feeling many different ways, myself included. Just that balance of how do we bring our whole selves to what we do in the world, how we try to serve in the world, and then how that dances with our democratic process in the United States, in the state of Colorado, and our local communities is something that I feel like I dance with every single day of my life and sometimes struggle with and sometimes feel a little more successful with, but it just feels really like apropos and really relevant today. So this is the day after the election today. And
yeah.
And it also opens the door for me and the folks that I get to work with to really question and re-engage and to say, what is our purpose? Why do we do the work that we do? And who is it in service to?
And that's a question that moves beyond our political beliefs, or it can, if asked the right way. So let me just, for our listeners, let's talk about what your work, your specific work, and we'll talk about personal purpose in a moment. But not everybody knows what community health centers do and how they are the heart of, they're their fabric of society in the United States, even though not everyone knows about them. Tell us a little bit more about that.
Yeah, thanks, Renelle. So community health centers are community-oriented, community-governed healthcare clinics across the United States. They started back in the 1960s in the war on poverty and the civil rights movement as well to make sure that all of our communities across the United States had access to affordable primary medical care. The real base of a community health center is affordable primary medical, dental, and behavioral health care for all within the community without regard to the patient's ability to pay. Typically, a community health center will end up serving lower income patients within the community, folks that struggle to have access to health insurance or are uninsured, or folks that are covered by what we call publicly insured health insurance programs like Medicaid, Medicare, the child health plan in many states. And then community health centers also serve all people regardless of ability to pay. So they'll serve commercial patients as well within the environment. But really, community health centers exist to make sure that people have access to affordable care within the community. And I had Renelle, when you and I met more than a decade ago, I had the great pleasure of leading a community health center in Western Colorado. I'm now serving in a role with the Association of Community Health Centers for the state of Colorado called CCHN, the Colorado Community Health Network. And in my work is really to uplift those community health centers, to support them, to pursue advocacy, lobbying, education, funding, and other items so that a community health center can really thrive and serve the patients within their local community.
Mm. So then come back to the question that you were just then asking the day after the election of why do we do what we do? Let's first start personally from a personal purpose standpoint. Tell me a little bit about your personal purpose, and then how does your personal purpose relate and integrate into what you do every day at work?
I was really blessed to grow up in a middle-class family in Colorado Springs. I'm the son of a preacher man. And so I had a pretty a lovely childhood growing up in Colorado Springs. And our family did not want for healthcare at all. It wasn't until 2006 that I really understood what it meant for people to struggle for access to health within the community. And this really drives my purpose and my why. And the story, which is a true story, goes that my wife and I got married in 2006, went on a lovely honeymoon, came back from our honeymoon, and my parents were standing on our front doorstep. And we thought they were there to welcome us home, ask how we were doing, how'd the honeymoon go? And they were there in part to do that, but they were also there to tell us that my dad had been diagnosed with Lou Gehrig's disease. And that disease would strip him of his muscle memory, his ability to really walk, to eat, and ultimately to talk as well, which is really hard for a preacher to not be able to talk, and ultimately would kill him about a year and a half later. And as I was helping him die through that process and dealing with my own grief in that process, one of the things that was really maddening was his health insurance company, United Healthcare, denied his coverage in the last couple months of his life for speech therapy and for physical therapy because he was terminal. That was the first time in my life that I had felt really screwed by the healthcare industry and by the healthcare system. And it built in me a fire, a purpose to fight for healthcare access for all, especially coming from a privileged background and coming from a family that didn't want for healthcare, and then experiencing that in a way that people experience every single day, whether they are insured or uninsured, to feel like you do not have an advocate fighting for you, or you cannot navigate the healthcare system, or it is rigged against you and it is focused more on sickness than on wellness and well-being for a human being. That experience in my life and what my dad experienced as well really drove for me a sense of purpose and meaning that I am called to try to use my skills, talents, relationships, and purpose to make sure that everybody has access to healthcare as a human right.
Thank you. So for those of you that are watching and listening, maybe now that makes a little bit more sense why we're equating purpose and heart. For me, I can feel your story and the reason you do this in your heart. Like purpose comes from our heart. It's not necessarily what we do, but it's who we are. And so one, just, reverence to your father. And sometimes it is those struggles and challenges in life that we stand up and say, we're called to do something bigger than ourselves. And I think that's what I've witnessed you doing the last 10 plus years that I've known you and what you just stated. So tell me a little bit more then about the heart side of this, and how do you balance in a system that we're in that is very linear and rational focused? How do you balance those two, the purpose, the heart, and as well as the linear and rational way we need to move through the world. Linear and rational is not bad. I'm not saying that. It's just, we're a little unbalanced sometimes.
Really good question, Renelle. I wish I had a secret sauce magic solution there. I think it is a discipline and a practice to try to balance that every single day. I think one of the things in healthcare that we do often to our detriment is we're focused on on seeing patients, on getting things done, on passing a new law, on fighting a law we don't like. And healthcare is notoriously made up of a lot of A students. There's a reason that doctors are doctors many times within the community, because we are focused on task and accomplishments and getting things done. That is not inherently bad, especially when it comes to increasing access to care for people. However, the counterbalance is that we need the space to breathe, to take time to digest, to compost our grief that happens on a daily basis. For a healthcare provider, they need space to really tap into their heart and say, like, how am I doing helping people deal with their chronic conditions or things that really aren't going well in their lives, or substance abuse disorder, or behavioral health issues that we all deal with? And so I bring that up because it is a constant balance and tension between how do we continue to kind of grow and expand, and yet also have this heart and compassion for those that we're here to serve. In my life, I try to be disciplined about that. I am not disciplined about that all the time. I have to be very conscious of taking the time to breathe, to take quiet time in the morning or in the evenings. One of my practical things is trying to go on a run by myself or with our dogs, to just get out and enjoy nature, bring in the peace that exists within the world before going right back into the fire of what is the chaos of the healthcare system a lot of times. So I see it as a ongoing discipline pursuit, and I have to work at it every single day to try to retain that balance. I notice when I'm out of balance because I get super stressed, I don't sleep. I rely on things that don't help me come back to my center. And when I am disciplined and can take the time for calm and quiet and reflection, I generally feel more at ease and sleep a little bit better at night.
Yeah. It's the paradox of wanting to make change, wanting to heal some things that are hurting us or broken. And yet we have to then come back to ourselves and say, well, if we work ourselves so hard into burnout, we're actually becoming the very thing that that we're so purposefully built to change. It also reminds me, it's two different things. Of one is the foundation of well-being and wellness in our society of just such a basic need,
Mhm.
as well as when I think about the conscious leadership work that I do and that we've done together, that is also the basis of that work, as we cannot necessarily shift into emotionally intelligent, conscious leaders that are transforming cultures without that basic well-being. We also can't be a healthy society that is progressing and moving forward without the base of well-being and wellness.
Absolutely.
So you're actually working in both, right? You're working in the bigger system where we need to shift, and you're working as a leader, trying to be a more conscious leader and transform those systems as well. What's that like to grapple with, to play with, to whatever word we might want to use for that?
I find it really interesting and connecting when I can walk into a room of kind of high powered CEOs or legislators or physicians. And instead of walking in with, what can I get out of you? I walk in with a curiosity of what drives you, Renelle, and what is your why? And that is true if I walk into a meeting with a group of hospital CEOs, or a group of legislators and the governor, or a group of healthcare providers. I think starting with the why and really understanding the human being is a really important part of the process before we get to the money, the politics, legislation. That understanding what drives you and what drives me is that human connection. It is really lonely for a lot of executives, not just in healthcare, but just in the executive position a lot of time, because there's a self-imposed pressure of I have to have it together, I have to be the expert, I got to be kind of number one getting everything done. And we are still children at heart that need somebody to love us and to care about us and to ask us what drives you and what is your why. So I think when I have the courage and we have the courage to ask each other that and to really pay attention to the human being in the room with us or across the Zoom screen from us, we make great connections and can actually move the world forward together. That has been one of the things that I've been trying to work on, is not to start with task right away or start with policy right away. Instead, to start with what is your why? What drives you? Or even just the simple check-ins of like, how are you doing? How is your family? How are your kids doing? I think that's really important, like human connection agnostic to whatever industry we live in. And that is, anyway, that's something I've been working on.
Yeah. Well, let's talk about that a little bit, because the task is important. We're going to do the task no matter what. We can do the task not knowing each other and not connected, or we can do the task connected and knowing each other. How do the results differ? As another example, you and I together, we worked in your last organization, working with conscious leadership with many different people. And then we did strategy. How does it differ to know someone, to know a little bit more about their heart, their depth, and then work on a task?
Great question. I think it just helps us own whatever the task is together. Instead of it being solely your responsibility or solely my responsibility, it creates a co-ownership model or a community ownership model when we are connected emotionally to then go do the task or tasks together, then we own that together. I think that is powerful and ultimately freeing for a lot of type A people like myself to share in that ownership and not have it all be on my shoulders.
Right, right. And how have you shifted over time? This is how you're leading today. You're continuing to evolve. Did you always lead this way? What, if not, kind of what has shifted over time to drive that playing with that tension, but moving more towards purpose and connection?
I think I have always had a bit of purpose and heart in my soul. Just, I don't know, being lucky, born into the family that I was born into and in the way that I was raised. And I think maybe what has changed is just more, or what I have worked on evolving is being okay with that tension, allowing that tension to exist, sometimes allowing the darkness to exist. I think, especially in my younger years, which I'm not that young anymore. So, but there's a long period of time where I would kind of run away from the darkness as fast as possible and be like, all right, let's get to solution. Let's not sit in the darkness. Let's not allow this grief to compost. Let's get after it and let's go solve it. It
Mhm.
probably, my evolution as a human being is about just having more of a comfort and a tolerance for that darkness is important in order to grow into the light. And that there is grief and sadness and disappointment and all those things that we all feel within our lives, and that is okay. And it's important to acknowledge it and to grow from it too towards the light. So they are not mutually exclusive. They're kind of codependent with each other. And that's probably how I've been trying to grow as a human and as a leader on the planet.
Yeah. You make such a great point that we tend to either shut down or not spend enough time in what might be the darker places. And and sometimes we can get stuck there too. And that's, I think, what we're afraid of a lot of times is that, well, if I look at that at all, I'm going to get stuck there. or we're going to get stuck there. We're never going to move forward. And yet, if we don't look at those darker places, those the grief, the fear, then it just sits in our subconscious and it starts to it's driving us whether we know it or not until we start to look at it. And so when we bring those both up to the light, then we can move forward. How do I want to ask this? Because we are talking the day after the election in the United States, and we don't know, there's a lot of unknowing. We don't know if tomorrow will look exactly like yesterday or if it will be completely different. So we do know there's potentially a lot of fear, regardless of how people voted. And so as a leader, if purpose is almost not the polarity, but the other tension from fear, how is your stance as a leader that's leading from purpose in a time that could be filled with a lot of fear? Why is that so important right now?
Yeah. Well, the text started coming in at like 3:30 this morning from my East Coast friends that were hearing our colleagues over here in the news at 5:30 their time, 3:30 our mountain time. I think I'll kind of describe what we've been doing around the CCHN table with the community health center CEO leaders. We did this a month ago for our strategic planning. We actually spent an hour talking about what is in the dark for us right now and what is painful. And then we spent an hour talking about what is in the light and what is hopeful. And we gave those equal balance, and every CEO in the room had the opportunity to share what they're really struggling with, what they're sad about, what they're angry about, and the opportunity to share what they are hopeful about, where the light is, where the inspiration is. And to your question about what that means as a leader, a couple things. One, I think we have to create space to have those conversations. It is important for me to be able to share vulnerably and to hear vulnerably from my executive or CEO peers in a safe space where I know nobody's going to use it against me. But that creates a human connection where it's like, oh, that sucks. You're going through that too. Or, gosh, you got it even worse than I've got it. Or, I can't believe that's happening. And then building towards inspiration on the light side. So we did that a month ago for our strategic planning with our CCHN CEO work group. And even this morning, we had a board meeting for the Colorado Community Health Network morning after the election. And there's a lot of tension and fear, regardless of how people voted. And we allowed a little bit of space to just hold those things, to acknowledge them, to share them with each other, to uplift each other, and to walk through the snow and the mud together. And I think that's the most important thing as a leader, is to allow the space for those to coexist and to walk together towards whatever the solution may be. And to show up. There's a lot of times where it's just like, I don't want to show up. I'd rather sleep in or go skiing today. And it's really important for folks that are called to lead to show up and to be present and to be there for each other, for our staff, and for our communities.
What's your sense? Holding space takes time.
Yeah.
And so it takes more time than just moving through it and saying, process this stuff at home. This doesn't belong in work. And yet, really, we spend a lot of time at work. And so tell me the importance. And I will admit, I think it's very important, and I see. So I have an opinion as well. But from your perspective, everyday leading, why take the time to hold space? Why is that important? Instead of just saying, "Hey, move on," and you'll get over that, because that's how it used to be and how it is in some places. And why is it important to take the time?
I'm kind of smiling because there's definitely been points in my career I'm like, all right, move on, let's go. Can't cry over spilled milk, let's move forward. Or let's just get the strategic plan done. Let's go, let's execute.
We've had those conversations before.
Totally,
yes.
Right? Guilty. I just think it misses the human connection part of it, because I am going through something and experiencing something, and you are going through something and experiencing something, and taking the time to connect. It doesn't mean that we spend the entire day stuck in that place. But taking the time to connect as human beings really drives, I think, as strategic organization. It develops deep emotional relationships and it binds people together to go accomplish a greater common good. And so that's why it's important, because we are not in transactional businesses with each other where the shareholder is the market. Our shareholder is the well-being of the people that we serve in our communities. And in order to do that, we have to have deep human connections with each other. And so, from a practical perspective, that means sometimes we block that out on the agenda. We put time on there so that people have an opportunity to talk and to digest. And then we have parts of the agenda, which are, what are our formal next steps? How does this fit within our strategic plan? What are the points of execution we are going to take out of this? But we don't do those separate from each other. We do those collectively together so that we've got this base of the why and the human connection.
Yes. And that's integration. That's what we're talking about, integrating the head and the heart, integrating the rational and the linear, the rational, and the intuitive, et cetera.
Mm-hmm.
I had a client once, he told me, or he reminds me that I said this to him, is that we get these, short-term inefficiencies for long-term gains. And so it might feel inefficient that we're taking all this time, but it will pay off later, because if you don't take the time now, at some point that's going to catch up with you and you're going to have to circle back as to why we only focused on task and did not focus on something that was that was the heart and relationship related.
Totally. I think about it like as a family. I think about it if my kids come to me or my spouse comes to me or my wife or my mother comes to me and it's like, I really need to talk to you about this thing that I'm worried about or I'm scared about or I'm happy about, I'm joyful about. If I blow past it and I'm like, well, yeah, that's fine, but we got to get dinner cooked or we got to get to soccer practice, and don't take the time to just listen and connect, then it's a transactional family relationship. But if I take the time to connect, or I feel like I'm heard, that somebody takes the time to listen to me with what I'm struggling with, what my joy is, then we're bound together as a family for life, because we have that emotional connection, and then we go do good things together as a product of that.
Right, right. We trust each other. We can move forward through hard things together. Absolutely. I've been doing change and transformation as well for many years. And sure, there's a rational component to it, but transformation is work of the heart.
Mhm.
And I would say the work that you're doing in healthcare, that's work of the heart that is supported by the rational and linear mind of moving it forward. But it's starting there. We're not going to make the kind of changes we need to see. Which, when it comes to purpose-based leadership, what kind of changes when you say access to health is a human right? We talked earlier about your personal purpose for that, but say more about why that's important for our society in general. What transformations do we need to make?
I think often of, and this is part of my professional purpose and also personal purpose, but I think often of those folks that cannot afford healthcare, do not have health insurance coverage, are from low income families. I feel really called to help support those people in need that don't have what others have. Uh, and there are so many beautiful things about being an American in the United States. We do have this massive tension that you can have great health care if you can afford it. If you cannot afford it, or you're low income, or you're from an immigrant family that struggles to find health insurance, you oftentimes will not get the health care you need. You won't get great health care. You may not get any health care. And so there's this massive, it's called the Gini coefficient in economics, but it's this difference between those that have and those that don't have, and who controls the wealth and who does not have the wealth. And we have a massive Gini coefficient economically. We also have a massive Gini coefficient from a healthcare perspective. So as I think about health as a human right and affordable health for all, it means that every single person in the United States of America would have access to affordable healthcare primary medical, dental, and behavioral health, regardless of their income, regardless of their insurance status. We have made some amazing progress in the United States through Medicare and Medicaid expansion back in the 60s, through the Affordable Care Act 15-ish years ago, or so, or maybe it's not that long. I don't know. Time stands still. But back in 2010, I think is when the Affordable Care Act passed. We have in the state of Colorado expanded Medicaid for our most vulnerable populations. We are about to expand Medicaid for undocumented pregnant women and their children in the state of Colorado, which is really, in my estimation, important movement forward that all human beings deserve access to health insurance and care. And we still have hundreds of thousands of people in the state of Colorado that do not have health insurance today and oftentimes cannot access affordable health care. And the question for me is always, well, how many thousand or 100,000 or 10, how many is too many to not have health care and health insurance in our state and in our country? What are we morally okay with? When it's my friends and neighbors and my community members, the answer is zero. And so I think we need to still continue to work forward on what are some market-based solutions, what are some public solutions. Those are not mutually exclusive. They can coexist together and do coexist together in the real world. But to continue to move forward so that every single human being has affordable health insurance and access to affordable health care. I feel super called towards that. And I think there is, I am hopeful that there's possibility to pursue that in the United States and in the state of Colorado. We have some good history on our side, and we still have a heck of a lot of work to do.
Absolutely. And what will that do for our society if more people have access to healthcare, and what does that look like? What is your vision of that? What does that look like when you've accomplished that? Not you alone, but you've been part of that.
We've accomplished
when we have accomplished that, yes.
I think there's some basic economic principles around that. There's a story called Kaiser Wakes the Doctors of when Kaiser in the California shipyards actually created free healthcare for all of his employees in the San Francisco area. This is a long time ago, like 150 years ago. Created free healthcare for all of his shipworking staff and their dependents because he wanted to have healthy staff that could do their jobs. So there's an economic component of it, which is if we are all healthy and can do prevention and primary care or access that in an affordable way, we're economically more viable because we can go to work and we can generate economic activity and well-being for our own families and for our community at large. There also is the benefit of us investing in our own well-being and as a society investing in my emotional well-being, my behavioral health, my physical health, my oral health as well, so that I can live a happy life. Most of us don't want to spend most of our time at the doctor's office or in a hospital. We'd rather be out in nature with our families, doing things we enjoy, eating good meals, seeing a movie, whatever that is for a family. And so I think having access to affordable health insurance and affordable care allows us to do what we want to do in our lives, to be healthy and happy, and to be economically more vibrant as a society as well. I think there are really good examples from many other nations that have made more progress on this than we have. We have a sense of American exceptionalism of that, oh, we're going to figure this out and we know how to do it better than others. I would challenge us that the data is not really on our side and the results are not on our side right now. So we have some honest reckoning to do as a nation if we really want to have the healthiest people and continue to promote a very vibrant national economic picture. We should make some serious investments in the health and well-being of all people in the society.
Absolutely. Absolutely. And, what you say resonates so deeply with me because we need that in order to make any type of true movement forward. And of course, I am a proponent. My purpose is to develop more and more conscious leaders. And it's very, very hard to be a conscious leader without basic well-being.
Mm-hmm.
So, Ross, thank you. The last question before we go is just what do you have to say to other leaders that why should they lead with more purpose if they're not already? Why should they continue this way? Why might they go down this path of a more purposeful, or I'll use conscious leadership? What advice would you give, or what would you say? Like, yes, keep going for it.
Hmm. I want to like what I do. And then maybe that's a selfish statement, but I just want to feel joy and really appreciate and like what I do in the world. And I want to feel good about that. And I want others to feel the same way. And so the pursuit of conscious leadership, I think, opens up one's heart and head to be able to serve in a way that's meaningful to you, where I'm able to say, that's important work. And I'm glad I'm engaged in this work. And it doesn't have to be within my industry. It doesn't have to be within the healthcare industry. I think there's so many different vibrant industries across the planet, across our state and the nation where choosing to serve in a way that is meaningful to you, to develop yourself and your community is very inspiring to me. So I'm hopeful that others will really lean into this work and try to pursue that on behalf of themselves, on behalf of their families, and behalf of their community.
Absolutely. Yeah, we've got to do that for ourselves before we can truly, truly be doing that for others. Service takes on a whole different meaning when we have really worked on ourselves. So thank you. Thank you, Ross, so much. Thank you for the work you're doing in the world. Thank you for your friendship. Thank you for continuing to be a model for us all of what it means to lead with purpose.
Thanks, Renelle. It was lovely to be with you today.
Thanks. Talk to you soon. For more information, visit insight-cc.com or email us at info@insight-cc.com. We look forward to hearing from you.